Tēnā koutou katoa, ko Lisa toku inga was. My name's Lisa. You probably will know me by now. I'm a senior research fellow at the Campus Research Centre. I'm also a committee member and the community organiser for Tuberous Sclerosis Complex New Zealand, which is a rare disorder charity that falls under the umbrella of Rare Disorders New Zealand. So I was very lucky to obtain funding for this project from Ember Innovations, and Rare Disorders New Zealand have been supporting me from before I submitted my grant application, which is a good couple of years ago now. So I really wanted to acknowledge especially Kim and Chris and Angela and Alana for the support that they've given me, and my colleagues at Tuberous Sclerosis Complex New Zealand, and all of the support group leads and all of the members of support groups who provide that support and kind of keep me going, keep it real, I guess, for me, so it's not just numbers. And I do just want to do a plug for my podcast, not my podcast that I was interviewed for. Alana from Rare Disorders New Zealand interviewed me, and I believe she's just done one with Denise as well. And there's also one she's done with James McGorham, who is the chair of Rare Disorders New Zealand board and have to move to Australia essentially to be able to get treatment for the rare disorder he has. So this project really came about because I am an IDI researcher, and that's what I've been doing for the last 5 or 6 years. And I knew that we really didn't have much data on rare disorders within New Zealand. I was doing a project that looked at chronic conditions and the impact of those on individuals and on their family members, and I thought, why don't I do this for rare disorders? And so it was a small amount of funding, but the idea was to really get some basic information about people with rare disorders in New Zealand. They're all people who have been diagnosed with a rare disorder. So the way that I've been able to identify information on those people is from their hospital discharge records, if they've used disability services, or if they've died. So if they have if they're not recorded in any of those places, unfortunately I'm not going to be able to have picked them up for my project. But the data do go back a long way, from 1988 up to 2024. The hardest part of this was trying to figure out the coding. So I've ended up searching for over 900 conditions, and by conditions I mean ICD-10 conditions, and actually some of those conditions have probably over 100 individual rare disorders that fall under those umbrellas. All of those conditions are rare, and actually even just having that ICD code is rare. So I've included those in my project, even though we won't be able to know what specific rare disorder somebody might have if they have that code. I've then looked at lots of different information about people. The idea is to understand kind of who people are and what's happening with their pathways through the care and health systems. So where I'm at the moment is I now have essentially 3 kind of data sets. So I've got these records of every record of a rare disorder diagnosis, as long as it's one of the ones that I've searched for. So that's from hospitalisations and mortality data, which uses ICD-10, from disability services, which uses their own code. And from there, from all of those diagnoses, obviously some people, if they're hospitalised more than once, will appear more than once in that data set. I've then got my group of people who've ever been diagnosed with a rare disorder that I've included in my searches. So that's what I'm calling the RD cohort. And then I've also looked, because obviously some of those people will have died, some will have left New Zealand. So I've also obtained a cohort of people who were living in New Zealand in 2023, which is particularly useful because we had a census in 2023, so I'm able to get lots of data. So I've also got a third data set, which is all of the interactions that those people in my RD cohort have had with hospitals, outpatients, disability services, I think that's mental health services, and I've looked at that 5-year period from 2019 to 2023. So that's going to be really useful when I get to the next stage, which I'll talk about at the end. And within those, for those individuals, I'm able to link to other data from other data sources for them. So at the moment, I've done that for some of the core population data sets, for census, for health and disability, and for aged care, in order to look at what other health problems people have, mainly. So just a couple of disclaimers. These are likely to be undercounts of the true number of people with rare disorders in New Zealand, because many people with a rare disorder won't have been hospitalised or used disability services. As I've said, although many rare disorders share an IDI code between them, there are some conditions that where the ICD code that they share is for a more common condition. So I can't use that code because it will include all those people who don't actually have a rare disorder. It's very likely that people included for this project were those who have a rare disorder or another condition that has really severe impacts on their health, because then they've been hospitalised or they've died or they've used disability services, and they had that first recorded diagnosis at a time when they were seriously ill or died. So they might well have been living with a rare disorder for a long time, being seen by their GP or by outpatient services. It's not until they are hospitalised that they pop up in my data set. And also just the IDI disclaimer, these results are not official statistics. They've been created for research purposes from the IDI, which is managed by Stats New Zealand. So this is my rare disorder cohort. People who have been diagnosed with a rare disorder in New Zealand. I've got around 370,000 people in that data set. They have at least one of about 870 ICD disorders. Around 17%, so it's quite a high amount, have had more than one rare disorder diagnosis recorded. That doesn't necessarily mean they have more than one rare disorder. It could be that they've been diagnosed with a number of different disorders until, it was finally figured out which disorder they have, but they will crop up multiple times with each of those diagnoses. You can see that this is the way that ICD-10 disorders are grouped into these chapters. There is a lot of overlap between these, and I'll be working on some different ways of classifying the different types of rare disorder, but just for now, this is the ICD-10 kind of different chapters. You can see there's it's about 26% of people, I think, have a congenital chromosomal or genetic disorder. TSC is a genetic disorder, and my background's in neurodevelopmental research, so that is one that I'm particularly interested in. But you can see a full range of different conditions, different systems being affected in the body. So overall, we didn't really find any gender imbalance within that rare disorder cohort. It's pretty much 50-50 male and female. We've got a kind of, this is the percentage of people within the rare disorder cohort that identified with each of these ethnic groups. This is total response data, so people can identify with more than one ethnic group. And this is taken from the census and other tables, so it's not just from their health records. This is mainly self-reported data from the census. And I think this is given that we're looking over a long period of time, roughly what we might expect to see in the population. We can see that 27% of the rare disorder cohort had their first diagnosis when they were under 18 years of age. And you can see there's a big spike there at the top of babies being diagnosed with a rare disorder under 1 year of age. So that is, going on. That's about 12% of the cohort. We've got around 40% of people having their diagnosis first recorded when they were 18 to 64, and then around a third of people when they were age 65 and over. So this could be that they've been living with their rare disorder, it hasn't been picked up until they've developed other health problems, or it could be it hasn't become severe enough for them to be hospitalised. But we have a pretty kind of older cohort. Around 140,000 people within the rare disorder cohort died. That's perhaps not surprising for some people that if the records go from 1988 to 2004, so if they were already 65 in 1988, it's perhaps not surprising that there will be people within that cohort that have died, but some of the statistics of how old people were when their diagnosis was first recorded are more stark. So 14% of children who were diagnosed when they were under the age of 1 died. That drops down when we get to the kind of from infancy onwards, but then starts to rise again. And so I've looked at, as I've said, that's the whole cohort. I've then looked at just people who were alive, living in New Zealand in 2023. There were 213,590 people, which is 1 in 24 people in New Zealand. So we know that what we would expect to see is around 1 in 17 people. So you can see where that undercount in this cohort is coming in. There were nearly 15,000 people who had their diagnosis first recorded in 2023. So people who might be in need of those support groups and the support that Rare Disorders New Zealand might offer. And this is the age of those people, the age they were in 2023. So we've got around 20% of people living with a rare disorder in New Zealand who were under 18. And then we've got the middle group, and then we've got around about 30% in that 18 to 64 age group, and then 50% of the rare disorder cohort were aged 45 or over. So you can see again it's an older cohort. And this is just the latest thing I've done. I've looked at some of the additional health and conditions that people have within that cohort. And you can see that if you look at the blue column, we've got neurodevelopmental conditions, not really diagnosed in under 1s, so there's no data there, but you can see that by the time we've got children 12 to 17, which is where we would be expecting some of those diagnoses to come in, we're over 15% of 12 to 17-year-olds with a neurodevelopmental condition, which is quite high. We've searched for a select set of physical health conditions, which are generally those that are perceived as being quite common, but also having a big impact on people's functioning and their daily living. And you can see, so this is the red line. Again, a large proportion have a physical health condition. This could be directly related to their rare disorder, could be that they've been misdiagnosed at some point with a more common condition. But I think it is likely that people are experiencing a lot of other health conditions. And then if we look at the mental health conditions, you can see that this starts still rather high in the younger age group, but begins to increase steadily. Now, this does come with a caveat, because mental health conditions is the only category where we've included pharmaceutical data. So it could be that people are being given medications for mental health problems, designed for mental health problems, but they're actually receiving them for other things. We do see this tends to happen a lot in older people, but compared with some of the other studies where we've looked at the number of people in New Zealand with a mental health condition using the same search criteria, these numbers are very high. So I think in that 65 and over age group, for the whole population, we saw around 30% with a mental health problem, and here we're seeing about 75%. So really, I need to do a lot more work on this. I've got data on the individual conditions. I still have a lot to do. So currently with the data I had, I need to look at people's socioeconomic circumstances, what areas are they living in, what areas of deprivation. Really interested to look at co-occurring pain. That's probably just come out from the last week, where I've been meeting people from the rare disorder community and discussing that pain is a common issue for a lot of people. I have all of this data on people's care pathways and what's been happening to them with the health system that I'll be looking at. What I'd like to do next, if I can have more funding, is look at the impact on people's wider kind of social outcomes, and also the impact on their families. And I really want to make this data accessible. So I will be publishing it, but I really want to find a way that if a support group lead can find the data, can look at what's going on for the people that they support.